Today I will be talking about the diseases of the genital and urinary tract. I will focus on three common diseases: genital warts, genital herpes, and gonorrhea. To start off, I will be talking about genital warts. Genital warts are one of the most common types of sexually transmitted infections. They come from the human papillomavirus. This infection affects the moist tissue around the genital area. Genital warts is one of the most common sexually transmitted infections. There are many different strands of this infection, some with complications. Vaccines have been developed to fight the bacteria and to prevent certain complications. Genital warts was believed to be manifestations of syphilis or gonorrhea until CUFO demonstrated cell-free transmission experiments in 1907. Complications of genital warts are different types of cancer and dysplasia. Dysplasia is caused by the strains of HPV 16 and HPV 18. These strains cause precancerous changes to the cells of the cervix. Other cancers that are complications from genital warts are cancer of the vulva, anal, throat, and esophagus. There are many symptoms involved with genital warts. One may have pink or brown swelling in the genital area, itching and discomfort, and bleeding with intercourse. These warts can be small and flat, almost unnoticeable, or raised depending on the severity of your case. When the warts are formed closely together, they tend to form a cauliflower shape. On the left is an image of genital warts on a female, and on the right is an example on the male genitals. Genital warts are diagnosed through appearance, Pap tests, and HPV tests. They will appear flat or raised and may resemble a cauliflower shape when there are multiple warts. A biopsy may be done to test for the virus. Pap tests are done on women and look for vaginal and or cervical changes that would signal genital warts or cervical cancer. Pap tests are done by collecting cells through swabbing the cervix. These cells are then examined for abnormalities. HPV testing is done by sampling cervical cells to look for strands of HPV. Some types of HPV can lead to cancer, so testing is always done for a woman aged 30 and older. This infection is spread through skin-to-skin contact, and anyone who is sexually active can be infected. This is extremely common if preventative measures are not taken. There are different medications and surgical treatments for removing these warts. First, I will go through some of the medications used to treat genital warts and the side effects. The first one is a cream that is used on the external genitalia or around the anus. This can cause redness, itching, burning, and sometimes pain. The next medication is also a cream. This cream helps to boost your immune system to fight off infection. This may cause redness as well. Third is a plant-based resin that destroys the wart tissue. There are two versions of this cream. One needs to be applied by a physician, and one can be applied by yourself at home. Lastly, there is a chemical treatment that can burn off the warts, and it can be used internally. This treatment method can have side effects causing mild irritation, sores, and pain. There are also surgical treatments for genital warts. These include freezing, electrocautery, laser treatments, and surgical excision. Freezing will cause a blister to form around the wart, which lets the skin heal safely. Side effects of this form of treatment will include pain and swelling. Electrocautery is a procedure that is used with electrical currents to burn off the warts. There may be pain and swelling following this procedure. Laser treatments are used as a last resort because of the pain and scarring involved. And the surgical method is when tools are used to cut the warts out. This also has side effects of pain and swelling. The next disease I will go into is genital herpes. This is another common type of sexually transmitted infection. The herpes simplex virus, HSV, is the cause, and it is spread by skin-to-skin contact. An individual with this disease may have mild or no symptoms, but still can be able to spread the virus. As of now, there is no cure for this disease. Genital herpes is a commonly sexually transmitted infection and is spread through skin-to-skin contact. There is no cure, and it is caused by the herpes simplex virus. This disease has been infecting people for millions of years. The differences between type 1 and type 2 herpes was distinguished in 1967. There are many complications that can come from untreated genital herpes. Disseminated herpes is when the infection spreads past the initial point of contact. This includes developing multiple sores or sores in different areas. Ocular complications begin when the infant passes through the birth canal. The infant is then infected with HSV2 and can develop eye infections, discharge, and sores on their eye or eyelids. The third complication is when the infection spreads to the brain. This will cause developmental delays in children and cognitive defects in adults. Hearing loss is also a complication of genital herpes. Sudden hearing loss is seen in adults, and infants may also be born without hearing abilities. This is due to the virus affecting nerves that control the hearing. An individual with genital herpes will experience pain, itching, small bumps around their genitals, pain when urinating, discharge from the vagina or urethra, and flu-like symptoms. They may also get painful ulcers and scabs. Here is an example of genital herpes on both a male and a female. The three common ways to diagnose this disease is through an examination, taking samples, and STI testing. During an exam, the doctor can make a diagnosis based on the appearance and the history of sexual activity the individual has. Samples may be taken to test for the herpes simplex virus during an exam. These tests will show if the individual has HSV1 or HSV2. In some cases, a blood test may be done to determine the type and the severity. Lastly, STI testing is recommended for yourself and for any sexual partners that you have been with. This will check for genital herpes and other sexually transmitted infections. The CDC estimated that there were 572,000 new genital herpes infections in the United States in a single year. Nationwide, 11.9% of people aged 14 to 49 years have HSV2 infection. HSV2 infection is more common among women than among men. The percentages of those infected during 2015 to 2016 were 15.9 versus 8.2 among 14 to 49-year-olds. This is possibly because genital infection is more easily transmitted from men to women than from women to men during penile vaginal sex. The medications used to treat genital herpes are not a cure, but they do help with the side effects. They are all antiviral drugs that will help with side effects such as sores and blisters. These drugs will lessen the severity and duration of the infection, lower the chances of reoccurrence, and being treated will reduce the chance of passing the infection to your partner. The last disease I will elaborate on today is gonorrhea. Gonorrhea is a sexually transmitted infection caused by a bacterium that infects both males and females. This most often affects the urethra, rectum, throat, or cervix. This is spread by anal, oral, or vaginal sex. Babies can also be exposed to this infection if the mother is infected. The bacteria of gonorrhea is called Neisseria gonorrhoeae. This bacteria infects the mucus of the reproductive tract, including the cervix, uterus, urethra, and fallopian tubes. This bacteria can also infect the mouth, eyes, throat, and rectum. This disease can be traced back to the earliest record of humans. Albert Neisser first described gonorrhea in 1879. Complications from gonorrhea occur when the disease is not treated. Pelvic inflammatory disease happens when the disease spreads to the uterus and the fallopian tubes. This can cause a woman to become infertile or have an ectopic pregnancy if it is severe enough. Symptoms are abdominal pain and fevers. It can also lead to internal abscesses and chronic pelvic pain. Men have the chance of developing epididymis, which may also lead to infertility. The last complication of untreated gonorrhea is disseminated gonorrhea infection. This is when the infection spreads to your blood. This can be life-threatening and characterized by arthritis, tenosynovitis, and dermatitis. Symptoms of gonorrhea in women are increased vaginal discharge, painful urination, and abdominal or pelvic pain. Women also experience vaginal bleeding between periods or after intercourse. Men experience painful urination, pus-like discharge, and pain or swelling in one testicle. Gonorrhea can cause symptoms in other areas of the body. Symptoms in the rectum include itching, pus-like discharge, spots of blood on paper while wiping, and having straining bowel movements. Symptoms in the eyes are pain, sensitivity, and discharge. The symptoms in the throat may be a sore throat, a swollen lymph node in your neck, and swollen lymph nodes in your neck. Lastly, symptoms may be in your joints due to the bacteria septic arthritis. Symptoms in joints may include warmness, redness, and pain during movements. Here are examples of the male on the left and the female on the right. You can see the discharge from the infection. Carrying mothers who are not treated for their disease are at risk for miscarriages, low birth weight, premature births, premature ruptures of membranes, and chorioamnionitis. Babies can be infected if their mother is infected and not treated. Babies will come in contact with the disease as they pass through the birth canal. It is important to get the infant treated as soon as possible to avoid eye infections. This photo shows the side effects of a baby with gonorrhea. The discharge is exiting from the eyes. A urine test is done to identify bacteria in their urethra. A swabbing is done of the throat, urethra, vagina, or rectum, depending on where the infection is located. This swab is then sent to the lab to identify any abnormal bacteria. There is a self-testing kit women can do at home. The kit includes a vaginal swab that is sent out for testing. Results for at-home tests can be found online or by calling a hotline. It is also recommended to be tested for other STIs. Gonorrhea will increase your risk of developing other infections. It is especially important to be tested for chlamydia because it is often seen with gonorrhea. People at risk for gonorrhea are anyone who is sexually active. The U.S. reported the highest rates are among teenagers, young adults, and African Americans. The CDC estimates that approximately 1.6 million new infections occurred in the United States in 2018, and more than half occur among young people aged 15 to 24. Gonorrhea is the second most commonly reported bacterial sexually transmitted infection in the United States. There are slightly different treatment options for adults, children, and partners. It is recommended for adults to receive antibiotics, sometimes a shot injection, and to avoid sexual activity for at least 7 days. Children are treated with antibiotics to help fight the side effects. Partners need to be screened and treated within the last 60 days. If a partner is not treated, they may be spreading the disease without knowing, even if they show no symptoms. I included some statistics to show how relevant these diseases really are. For genital warts, about 1 in 100 sexually active adults in the U.S. has genital warts at any given time. For genital herpes, an estimated 491 million people aged 15 to 49 worldwide have herpes simplex virus type 2 infection. For gonorrhea, only 20% of females and about 10 to 15% of males will develop symptoms of a gonorrhea infection. And then I have included my references at the end of the slideshow. Thank you, and let me know if you have any questions.